Hello everyone, my name is Jerry Pohl and today I'll be discussing the teach-back method with you. The purpose of this presentation is to prove how effective the teach-back method is in assisting patients in fully understanding their discharge instructions. Patients experiencing the teach-back method will be compared to individuals at a higher risk of readmission when the teach-back method is not integrated into their overall education. The teach-back method is a tool that allows the healthcare provider to determine if a patient understands the information and instructions they are being provided by requesting the patient and/or family member verbalize in their own words the important things they need to understand concerning their health. This topic is important to future research because although a simple method, it has not been appropriately utilized by staff members in many situations. It is important to validate this method healthcare professionals as not only the right thing to do for patients, but also to help the healthcare professional understand that time spent with patients to integrate this method is done to prevent further inpatient stays at a later date due to misunderstandings leading to poor personal care. On this slide, you can see the description of the PECOT. Population is discharged patients from inpatient or outpatient units. The intervention is the integration of teach-back method patient education methods. The comparison is to individuals that do not receive education with the teach-back method. The outcome is to decrease the likelihood of readmissions or decline in the overall condition. And the time frame is the intervention to occur during the discharge of patients. The search history included keywords for teach-back method or patient education, key phrases such as readmission associated with knowledge deficit, barriers to patient education, preventable errors through patient education, and the time frame is to only utilize peer-reviewed articles within the last 5 years. The reason for this study is continued misunderstanding of information and lack of communication that is directly linked to worsening patient conditions, readmission, and increased financial burdens on hospitals and patients alike. The first theme noted within my research identified that the support of healthcare providers and their buy-in on the continued use of the method. Without this support, it is impractical to believe that the method would continue to be used after the conclusion of the studies. Klingbeil and Gibson put it best when they stated, "The teach-back method is an evidence-based strategy identified as a cornerstone intervention for improving communication during healthcare encounters." This quote is straight to the point. The intention was to improve interactions, not complicate them, and the teach-back method has done exactly that. Dine and colleagues discussed results from their study, as well as identifying that this was a new process integrated within a Vietnamese hospital because it was the nursing staff that self-managed the intervention. Through this method, they found that using the teach-back method was not only appropriate for patients with low educational levels, but also extremely feasible for the nursing staff to provide within an overcrowded facility and use during routine interactions and clinical care. Although done in different settings and interpretations of the methods, the main theme was the support for the method by stakeholders. Pelavisky and colleagues provided a literature review that included the sustainment of the use of the teach-back method by healthcare professionals longitudinally instead of only determining if it assisted the patients during a short period of time. This is essential in understanding that the method was seen to be useful and easily integrated into the normal flow of daily inpatient care, so much so that employees continued to utilize it without pressure from their leadership after the initial phase of the study had been completed. The second theme noted throughout the research was an increased patient understanding. Although not all studies found a significant improvement in patients' long-term outcomes, they did note an increase in their level of understanding compared to when they were educated within the teach-back method. Themes throughout the articles also included support by stakeholders, as mentioned previously. None of the reviewed articles identified staff dissatisfaction with the method. Contrary, they all noted the method was easy to use, did not complicate their shift, and did not appear burdensome or delay the care that they would provide to their patients. The use of the teach-back method was directly associated with an increase in functional health literacy when young adults with kidney transplants were studied to determine if they would have a better grasp on the medications they consumed and their individual medical condition. An increase in life longevity was not studied and will require further assessment on those patients. A study done in Vietnam did identify that overall longevity did not increase in patients with heart failure, but patients identified that they had a better understanding of their care and adjustments they could make to have a better life day to day. In conclusion, it can be inferred from the relationships between the gathered literature include that the enjoyment of the method by both staff members and patients alike was high. Although the longevity of life may not have increased in patients who received the education prior to mortality, they reported increased understanding of their condition and support for continued education with this method for others. There is also a common conclusion that most patients did not originally understand how much of their care they were misunderstanding. Yin and Leisure documented it best, in conclusion with other articles, that the method is functional and effective in supporting patient education, as well as identifying what information the patients have not absorbed. Also, similarities existed in determining that there was not a decline in understanding of information by any participants in the study within the literature, identifying that the Teach-Back method did not prove any risk to patients in decreasing their overall understanding. The literature review showed a strong relationship in its support for continued patient education and desire to find the most effective way of providing education in the hopes of strengthening the culture of quality within the healthcare system. 3 John 1:2. Dear friend, I pray that you may enjoy good health and that all may go well with you, even as your soul is getting along well. Through prayer and desire to find wisdom for the benefits of the sick in need of care, healthcare professionals can fulfill the desire of the Lord. Thank you so much for listening to my presentation. I hope you have a great day.